Greetings, sacred clients. I am Kirby Clark Ellis, Master Massage Therapist, board certified in therapeutic massage and bodywork. Welcome back to the last video in my series on informed consent body regions. This Massage Monday, we're talking about gluteal massage. The glutes are considered a body region that requires informed consent because, let's face it, this is a region that is located adjacent to the genital regions and other erogenous zones, which might also include the rectum or anus. For this reason, the glutes can be highly sexualized by our culture or misinterpreted as inappropriate or suggestive without the proper education on the benefits of therapeutic, non-sexual gluteal massage. This is also a region that is located within the cultural boundary of undergarments, which are highly personal and intimate for most people. Some clients may also feel an awkwardness or self-conscious about having their glute muscles touched. Other clients may not be aware of how gluteal massage would be performed or the secure draping procedures administered. Speaking of which, let's talk a bit about draping. The massage client should be assured that their center will always be covered. The gluteal cleft, which is commonly referred to as the crack, which includes the anus and or rectum, will never be touched or undraped during a professional, legal, therapeutic massage session. The drape should have the sheet tucked under the client's hip bone or the top of their leg in order to secure the sheet in a diaper drape. Therapists should take special care to never let their hands or fingers slide beneath a drape or the waistband hemlines of a client's undergarments. The drape, just like clothing, becomes a therapeutic boundary or a nonverbal contract between therapist and client. Therapists can readjust the drape and ask if the client still remains comfortable, but their fingertips should never be allowed to slip underneath the drape. When working with the glutes, I personally never ask a client to hold a drape. I also will never tuck a drape into the client's clothes or their hemlines or waistbands. To me, it feels invasive and it crosses the boundary that the client already set by wearing clothing during their session. You can see in this demonstration that I primarily work and drape from the back region instead of from the legs. The massage strokes can be extended into the client's back. You may also notice that I like using my elbows and forearms as opposed to working with my palms or fists. To me, this doesn't feel as suggestive or intimate as using my hands. There is a sense of separation when working with your elbows or forearms. I am also in the practice of moving my strokes through the hips into the client's back region. Methods of working with the glutes should be slowly and then easing deeper into tissue. In terms of anatomy, there are 5 muscles, which includes the piriformis, and 4 bones, 2 coxal bones, which are actually made up of 3 bones themselves, and 2 femurs, 1 on each side. The bones and joints that are in this region are larger compared to the rest of the body, which means that they can require more pressure and an increased duration of treatment in order to relax the soft tissue.